Hello and thank you for joining me for this TotalMD practice management demo. In this video we're going to go through a demo of the software to show you the flow of the software and also highlight specific features inside the practice management piece of the software. The first thing I want to show you is the home screen, and I want to show you that first just because it's the first screen you'll see when you first open the software. I like to think of the home screen like a desktop on your computer where you have your different icons that are essentially just shortcuts to different programs or documents, files, things like that. In this instance, with the TotalMD home screen, you have different shortcuts. These shortcuts are created by you, the user, and they're underneath categories that you've also created. So here we have some different reports that we might want to look at, different websites, different parts of the program we might want to go to. It's certainly not specific to TotalMD, meaning you could have links to other programs. Here's some links to some Microsoft programs I have. Here's a link, for example, like to the Windows calculator or whatever it happens to be. So you're going to create your own categories, and then you're going to decide which shortcuts you're going to have underneath each one of those categories. You can get to this screen from any part of the program simply by clicking on this home icon. Also inside the program here we have our forward and backward arrows, so it'll allow you to navigate similarly to a web browser. You can go back to previous screens or forward, the drop down arrows and whatnot as well. In addition to being able to use your mouse to navigate through the program, you also have the option to use shortcut keys. Shortcut keys are going to be keyboard shortcuts. For example, if you hold down the Alt key on your keyboard and click any letter that's underlined, so you'll see the letter U here, or the letter P or S, that just would allow you to open that. So for example, if I did Alt E, that would have been the same thing as if I would have clicked the setup with my mouse. So it takes me here into the setup. In addition, we use a lot of different function keys as shortcut keys. So your F keys up at the top of your keyboard, for example, you'll see here F4 is an option. Instead of clicking close screen, I can do F4. I'm not going to touch too much on the setup here, but I do want to talk about a couple of things. This is an area we've created where you can go when you first get the software in order to go through several different things to get the software ready to really be used. So the first thing we would tell people is to set up their practice, which will ask you for the basic information of the practice and doing some different program preferences. And then you want to set up users. And this is one thing I did want to just mention briefly. You can give every person in the office that you want to use the software a username and a password. Not only does the software then track what the user does, and you're allowed to see reports and whatnot on that, but it'll also allow you to give them a security level. We'll click on security really quickly, and you can come in here and see that there's different areas in the software, and each one of them has some different options here that you can choose. You can decide which levels can do which things in the software, and then you can assign each user one of those levels. So again, not only does it allow you to see what each user does, it also allows you to limit what each user can do. Now, although you can do a lot more setup, like putting in your insurance plans or putting in your CPT or diagnosis codes, these are also things that you can do inside the software on the fly. And so instead of going more in the setup, we're going to talk a little bit more of that as we go along. When I click on patients here, it's going to open up my patient list. Patient list by default is going to show you all your patients. This list, just like your other list that you might see here in your lists window, is very customizable. It allows you to decide which columns you want to show here on the list, what order they show up in, and how the list is sorted. For example, here I've got chart number, last name, first name, and then I have chart number, last name, first name again. So if I click on customize view as an example, I can come in here and I can remove those fields from being displayed. And so now I only have one of each of those columns. In addition, I can change the way it's sorted. For example, if instead of by chart number I wanted to sort by first name, I can click on this list and see that it's now sorted that way. Also, we have different filter options which will allow you to narrow down which fields you want to search by. For example, if I wanted to see everybody on my list that had this specific Aetna insurance, I could click on that and it's going to only show me that. I can combine filters as well. So for example, if I not only wanted to see everybody that had this insurance, but also everybody that had that insurance who had a first name that started with the letter J, I could do that. In addition, you have the option to rename your columns to be whatever you'd like, and even change the size, or I should say the width of each column also. A new feature that we also allow now is advanced filters. Advanced filters will allow you to do a lot more with the filters that are available here. So instead of being able to say, for example, I want to see everybody that has this specific Aetna insurance, under the advanced filter section you could create a filter, and you can create as many of them as you want and save them and go back and use them anytime you want. But you could say things like, I want to see everybody that has any insurance but this insurance, or show me anybody that does not have an email address, or anything else that you might be able to come up with. If from here we want to create a new patient, we can right click, do new patient, use one of our shortcut keys, or come over here to the left hand side and select new patient. If we want to edit a patient or open a patient, same thing. We can do F9, click over here, or click here, or we can just double click on a patient. I'm going to double click on James Davis. First thing we'll notice is that he has alerts set up. This alert box is divided into two sections. Up here at the top, we have something in red. Down here at the bottom, it looks like we have some medical information. When I click OK, it's going to open up his record. You'll notice here is where the top part of the alert box pulls from. Anything we type in here is going to pop up on that alert box. When we open up the patient, when we go into their ledger, when we schedule an appointment for that patient. We can make this font whatever size or color we'd like. The other part of the alert box pulls from here, and this is a list that's customizable by you that you can check items, and it'll also pop up in those same three places that I mentioned before. Now going back to this patient information tab, this is where you're going to have all of your patient demographics, names, addresses, phone numbers, and so on. Throughout the program, you'll see different drop-down areas. Anytime there's a magnifying glass next to it, this is an area where you create your own list. Your drop-down box is pulling from a list that you have created. And if you want to add an option right from here, you can certainly do that just by coming over here, do new employer, again right-clicking, or using your shortcut key. You may notice that here there's a red background and here's a yellow background to these fields. The software allows you to designate certain fields to be either required or recommended fields. So red fields are required, yellow fields are recommended. You will not be able to save a new patient, for example, without putting in a last name and a birth date, since I've set those up as required. The software will allow you to also designate a head of household for each individual. That head of household may be the same as the patient, but it may be somebody different. If multiple people have the same head of household, they will be linked together as a family. And you can see the different people that have the same head of household here. Scroll down if there happens to be more of them. You can even double click on it to go to that patient's record. The software also allows you to build your own zip code database so that when you type in a zip code, the city and state will populate automatically for you. There's different tabs of information up here. You have the ability to decide if you would like to hide any of these other ones. So for example, if you're a cash only practice and you don't want the insurance tab there, you can hide that, or any of these others. In addition, you also have the ability to create your own tab that you can add here to the top, and you can also create your own custom fields that you can put inside each of those tabs. So if there's a field inside the program that we don't have, you have the ability to create that field and save it in here. Also, you may have noticed down here at the bottom there's an eligibility status, and although I personally feel like checking eligibility is best done from the scheduler, you can check it directly from here, over here on the left hand side, and also from the ledger. This part of the patient information will display the most recent eligibility check information. If we click on the icon or the date here, it'll open up a list of every time we've checked their eligibility and show all those times here, and down at the bottom it'll show you the details of each individual time if you select it. Now there are several different ways to get to this person's ledger, like clicking over here on View Ledger, clicking F7 on your keyboard, or clicking Ledger here, which I'll do. You'll notice once again I have my alert box that pops up. If I clicked out of that too quickly and wanted to go back and look at it, I can just click on this red cross icon and that box will pop up again. Now the ledger is really the heart of the program. It's where all the financial information will be displayed. It'll show you all your dates of service, the specific procedure codes, the charge amounts, any payments or adjustments associated with those specific charges. One of the great things about TotalMD is it'll allow you to create different cases, or what we call billings, for an individual. So for example, right now we are looking at this specific billing here, but if we hit the drop down arrow here, we'll see he also had a previous billing for an entirely different diagnosis. If I click on that, it's going to open up the charges, payments specifically associated with that. Now there are many different reasons to have different billings, and not everybody chooses to create different billings. You could just put everything on one billing and that would be fine. But if a patient changes insurances, or it's an OB/GYN office and they have different pregnancies, each one of those could be a different billing. A chiropractor might see somebody for more than one car accident over the years. They want each car accident to be part of its own separate billing. Or some people just choose to have every single date of service its own billing. It's completely up to you how you decide to use this feature, but each billing is allowed to have its own authorization number and visit series, its own insurance, its own facility, referring provider, default diagnosis codes, many different things like that. If for whatever reason I want to see all the financial detail for this patient all on one screen without going through different billings, I can just click on this box here, Show All, and it combines them onto one screen. If I wanted to come down here to my filters and maybe change what I was showing here, if I didn't want to see zero balances, or I did want to see claims and statements that might have been printed, I could add those on here too, and those would show. Or again, I could exclude certain things if I was looking for something in particular. Each one of these items here has detail associated with it. So if I double click on any one of the descriptions, it'll give me the detail. For example, if I do it here where this insurance claim was printed, it's going to show me the actual claim. If I wanted to see a specific payment, for example, this $40 insurance payment, I can click on here and it'll show me that this $40 payment was actually part of a $100 payment from the insurance. If I click view, it's going to show me how that specific payment was distributed. This screen here, just like our other lists, is customizable, where we can decide which columns we want to show, what we'd like to get rid of, what size or order we'd like to put them into. If we unclick show all, it's going to take us back to a specific billing. The information up here is going to be specific to the billing that we're looking at. This information here is going to be all the billings combined. There's a tab over here that you can click on that'll give you more information specific to this billing, like your default diagnosis codes, the facility referring providers, primary care physician, authorization information as well. If your screen's wide enough, if you've got a widescreen monitor, you can click on these arrows here and it'll show you both of those tabs side by side. As you can see, my screen is not wide enough, so therefore I'm going to see it in a tab format where I can go back and forth between the two. If this patient has any payments that have not been applied to anything, they'll show up here and we can easily apply them by clicking on it and then distributing them. If we'd like to change the way we see this information and sort it different ways, we can come up here to view mode and it gives us different ways that we can sort this with different filters we could see it by. For example, if I wanted to see it by claim number instead of by date of service, we can see each of the two claims for this person. If we click on the plus sign, it'll show us which charges are on that specific claim. We could also come over here and do it by account code, and it'll group it by procedure code. It'll tell you how many of each procedure code was done for this person, and so on. Now, we call this an interactive ledger because it's also where we could add charges to an individual. Any new charges that we want can be put in here one of 5 different ways. Number one is they could come in from our EHR program, where if somebody was using our EHR, those charges would show up in a holding area where somebody could verify them and they would then import directly in here to the ledger. The second option would be a partner EHR program, which would function similarly, but it's just using an HL7 link instead. The third option would be using the option in the activities here, which would be called the mass charge entry. This is an option that allows you to assign one procedure code to multiple patients all at one time. Okay, the other two options would be doing it directly in here in the ledger, where we have one individual and we might do one or more procedure codes here. The first option would be to use the multi-code, and this is an option that allows you to create different code groups that you name, and by selecting one, 1 to 15 different charges could display here. And the last option would be doing it manually, where I can just hit the down arrow on my keyboard, or I could come over here to new transaction and it'll add a blank line, and I can just type in whatever code I'd like. One cool feature is the post date down here at the bottom, which allows you to change this to whatever date you like, and then any charges that you put in here would have that date instead. That way you don't have to change each line individually to a past date. You could just change this date down here once, and all new charges would go in with that date. Now that we've added 4 charges here into the ledger, we're really ready to create claims. Now we can create claims directly here from the ledger over here on the left hand side, and it'll just create the claims for this one individual. So I'll click here and it'll tell me here's the 4 transactions we're ready to be billed. Do you want to continue? I'm going to click no so I can show you how it works differently in the claims area of the software. Before we jump over to the claims area of the software, I do want to show you 2 more features. First of all, the ledger notes, which allows you to put a note tied to any specific charge here on the ledger. And you do that just by coming over here to the left-hand side and clicking add note or hitting F5. It puts in an additional line and you can create as many different default notes as you want. Or you can take a generic note like this and just change the description. So I could type something in there like that, for example. If I'd like even more detail, I can double click on it and come in here and put any more detail I'd like to. If this is something that you'd like to print on a statement that gets mailed out to the patient with their bill, you can simply check this box here and it'll print on the statement for that patient. If you'd like to add a note to the patient record that's not specific to a charge, you can hit F11 on your keyboard, or you can go up to activities and find patient journal there, and this screen will pop up. You can access this screen from any area of the software where a patient is selected, whether that's the patient information, the claims area, ledger like we are here, the scheduler, payments. But if you click F11, this window will pop up where you can add in whatever kind of note you'd like. It will list all the different notes here on the left-hand side. And anybody in the office that you're allowing to access the patient journal will be able to add notes or view other notes that have been added. Now let's jump over to claims. The claim list is going to be a list just like all of your other lists with different columns that you can customize and the different filters. By default, all of your claims will show here. If you'd like to narrow that list down to only see ready to bill or paid claims or whatnot, you can certainly do that. And just like the other list windows, there's a bunch of different filters you can use to find specific claims. Now remember in the ledger, when I clicked on create claims, it only found those 4 transactions that we had just added. What's different here is when we click create claims, it's going to go out and find all the transactions that are not on claims that should be, and it's going to put those on claims. You can also set the program up so that it'll ask you specific filtering questions when creating these claims. It might ask if you want to look for claims in a specific date of service range or for a specific provider or insurance or whatnot. If I wanted to put all 19 of these transactions on a claim, I just hit yes. Once it finishes that process, it'll tell you how many claims it created and whether or not any of them have failed validation. A claim fails validation by not meeting certain rules that are built into the program. Now, although there are rules that we've built into the program by default, you can certainly get rid of them or customize and add your own. If I click OK here, we'll see the new claims that were created. I'm going to change the sort to put them up at the top instead of at the bottom. And we can see that all 5 of them failed validation. If I'd like to go in, for example, to the one that we just did for James Davis, I can double click on this. And we can see that it'll open up the editable claim screen. I can actually come in here and type in or check anything I want. So if I wanted to change something on this, I could absolutely do that. You could also even do it with the secondary claim if they had it by clicking this drop down arrow. But if I click on the billing box, it's going to tell me here why the claim failed validation. I can see right here that there is no subscriber ID. So if I want to quickly fix it, I can click on the billing number where that's located, come in here and put in their policy number, their subscriber ID, save and close those changes. And when I'm back here, I can click update claim. Tells me it's been updated and now revalidates it, sees that it's passed validation. The information is now here where it originally was not. And if I go back to my list, I can see that now this claim is ready to bill instead of failed validation. The program also allows you to set up timely filing deadlines for each insurance. So for example, if NAUS Healthcare says that there's a 180-day window in which you need to file your claim, you can set that up, and as you get within 30 days of that 180-day deadline, the font on this specific claim will change to purple to give you a visual indicator you're getting close to that deadline and you need to follow up. If you haven't done so, just make sure it's going to be paid. Once you pass the 180 days, the font will turn red. If at any point the claim does get paid, the status will change automatically once payments are applied to the charges on this claim, and that font will change back to black. You can also view the deadline by coming in here to billing if you set it up, and it'll give you the date that it will expire here. Another feature that's not specifically tied to the claim list but is often used here is the task list, which you can access by clicking F12 on your keyboard. This is an area where you can create different tasks and assign them to different users. So for example, if I wanted somebody in my office to follow up on some of these claims that we created that were failed validation, I could type that in here, give it a specific priority number, and assign it to a specific user. If I'd like to, I can also give it a due date, and I can have a warning pop up if I want to on a specific date as well. Now in this case, Jill could come into the task list and she could sort by her specific tasks and see what it is she needs to do. Once our claims are ready to go, we can come over here to the left hand side and we can decide whether or not we're going to send them electronically or print them to paper. And we could decide whether or not we want to send all of our claims that are ready to bill or just choose certain claims that we'd like to send. One of the great things about our software is it allows you to choose whatever clearinghouse you'd like to send your claims electronically. We do have partner clearinghouses that work great, but if there's a clearinghouse you really like that you already use, you're free to continue to use them with TotalMD. Once we send our claims electronically or print them, the status automatically will be billed. If we go into the claim, it assigns dates to those claims as well that we can always see. Now the whole purpose of everything up to this point is so we can get paid by the insurance. The insurance is going to tell us how they've paid one of two ways. They're either going to send it in an EOB, which is a paper explanation of benefits, or an ERA, which is an electronic remittance advice, which is like an electronic version of an EOB. Our software very easily handles either of those two options. But the quicker and easier way is to use the ERA, which I'll show you how to do now. To apply an ERA file, you simply go to Activities, Apply Remittance File, and open the file that you received from the insurance company through your clearinghouse. Oftentimes information that you received on the ERA might not match exactly with what is in your patient's ledger. In a case like that, this message will pop up. I'm going to go ahead and click no, but we'll get back to that in a minute. On here we can see that we have an ERA that came back for 3 different people, Jesse, Monique, and Tad. Everything is okay with Jesse's, which is why it's white. Monique's has some sort of issue with it, which I'll show you in just a minute. And Tad has blue, which means his is denied. If we'd like to try to fix Monique's issue, we can click Fix Issues. And the first window that pops up says this is the information that came in, and it's not matching up with what's on the ledger. So we're going to go ahead and click next, and it's going to show us what's on her ledger. And we can see here's what came on the ERA, that they're paying for a 99211, but we actually billed out a 99212, and so therefore those two could not match up. Medicare downgraded the procedure code, and that is a legit payment. So we're going to go ahead and click next. And now that has matched that payment that came in from Medicare with what's in Monique's ledger. If we would like to edit any of the information, like the adjustment or what was actually paid, we can double click on here and do any of that. This information here is going to help with sending secondary electronic claims. We also have the ability again to add notes to a specific line or mark the follow-up box. By marking the follow-up box, two things happen. Number one, it does not pass the responsibility to the next party. It keeps it with this specific insurance. And number two, it prints on the follow-up report so that we can contact the insurance company to follow up with them. Once we get everything how we like it, we can determine which date we want the payments to post with, and then we can click post all. At that point, it'll go in and post those specific payments and adjustments against the charges in each of their ledger, except for Tad Stanford because his was denied. We could still choose to post the $0 payment if we'd like to, simply by clicking here on the box. The second way we can do the payments is by manually typing the information in. And although that's a little bit more time consuming, our software has made it very easy to do it still. We can do payments from the ledger or from the payment screen. Since we've been in the ledger already and have not done the payment screen, I'm going to go ahead and do it from the payment screen. We click New Payments over here on the left-hand side, and a window will come up where we can tell if it's a patient or an insurance. In our case, we're going to do insurance, what the insurance was, what the check number is, and how much they paid. Now, this payment amount is going to be what the entire payment was for, not just for a specific person. It could be a payment that came in for 2 people to 300 different people. We're going to put in the total check amount, and then we're going to distribute. We're going to take the very first person on our EOB. In this case, we'll do James Davis. And we'll do his first and then move on to the next patient with whatever money is left over. So in our case here, we'll say they paid $35, which they allowed $50. When I tab over, it's going to automatically write off the $10, which is the difference between what they allow $50 and what we charge $60. If we have additional adjustments we'd like to put in, we can. If we do takebacks, we can put that in here too. A takeback is where the insurance says we overpaid you on one charge, so we want you to take some of the money we paid previously to this person, take it away, and apply it to this person. So although payments are going to deduct from this amount, takebacks will add to this amount so you can distribute it to somebody else, or maybe even the same person, just a different charge. And again, we can mark the follow-up box or put in a note. If we'd like to add a new note from here that's not already in our list, since we only have the one here, we can come in here and we can just do new note, and it'll take us to a window where we can create new notes. We'll go ahead and finish distributing this payment here. So now that we've done that, we see that we still have $99 to apply to somebody else. So we're going to post payments. It's going to tell us that one claim has been marked paid because claim number 38 is done. And now it'll take us to the screen where we can choose the next patient on our list. Now we can come back to this $99 anytime we'd like. We're going to jump back to our claims list, and we can see that claim number 38 has been marked as paid. In addition, if we'd like to, we can click on this plus sign here, and it'll show you which charges are in here. If for whatever reason we'd wanted to change the order of these before we sent them, we could simply right-click on one of these and move it up or down. Now that the insurance is paid, maybe we want to send out our statement. So we'll come into reports, click on statements, and we have tons and tons of different statements to choose from. This happens to be one of my favorite statements, so I'll go ahead and choose this one. I'm going to leave the filters blank so that it automatically finds everybody that owes a balance. This particular report is a family statement, so not only does it have totals for James, but it also has Paige as well. We can see right here, here's what we did today. And here's the $15 that he owes for what would likely be his copayment. If we had wanted to put a note on here that said specifically it was for the copayment, we could have done that. I'll go ahead and print it to a file just so I can show you something here. Once we hit yes on this, it's going to create a copy that it saves in this person's record. So now, if we go into James Davis's ledger, we can see that not only did it put in the paper claim that we printed earlier for James Davis, but it also here's the statement. And if we double click on it like this, it opens up an exact copy of that statement that we can use to reference if that patient were to call us on the phone to ask questions. Now going back to the ledger, we can also see where previously we just had the charges. We also now have the payments and adjustments that we added in from the payments area. If James got that statement and decided he wanted to pay that $15 or $30, $15 from today's visit, or there's also an additional $15 from a previous visit, we could come over here to new patient payment, put in how he chose to pay. So we're going to say that he paid with a check and how much he paid. We can see here that he's got his family members listed here have balances. If we wanted to not show those and just show his, we could uncheck that. If some of these charges were still pending insurance, we could remove them from this list by checking this box here. We could come in here, decide how we want to distribute that $15, and save it. And now as you see here in the remainder column, where we used to have $15 here as the remainder, now is 0. The last area of the software I want to show you is the reports section. When we click on reports, it's going to automatically default you to your favorites category. You get to decide which reports are your favorite and add those to this favorites list. All the reports should be in at least one of these other categories. Obviously, all will have all of your reports. Most of the reports are going to have a sample of what kind of information is in the report down here at the bottom. If we'd like to search for a specific report by either the title or the description, we can certainly type it in here. And regardless of what category you're in, it's going to search all of your categories. So if I type in provider, it's going to show me all my reports that have the word provider either here in the name or in the description. If I wanted to add a report to my favorites, I could come in here, right click on it, and add it to my favorites. One of the great things about our reports is they're all customizable. So you can edit any report, either the information on the report or the filters that you can use when creating the reports. If you're not comfortable doing that yourself, we have staff that can do that for you. Also, if there's a report that you'd like to see that you don't see inside the software, we have a report writer that can do that as well. Running a report is as easy as just finding the report you want and double clicking on it. But there are well over 100 reports in here that should give you just about anything you might be looking for. In addition, any report can be exported to Excel or Word or PDF. And not only are those 100 plus reports in here, if you come over here to the left hand side and click Import Report, this window will pull up. And if you click on Additional, there's even a lot more reports in here that you could add into your list as well. Now the purpose of this video is to just give you an overall feel and flow of the software, but there's a lot of other things we didn't talk about. Whether it's coming up here and there's the mass charge entry, which we mentioned but didn't show, the ability to process late fees for individuals that haven't made payments on time, sending people to collections, doing electronic prescriptions or viewing graphs. Also, there's a program called Coding Advisor that integrates with the software that basically is like a code book on steroids. So if you ever wanted to do research on specific ICD-9, ICD-10, CPT codes, HCPCS codes, things like that, you can do that, and you can also import them directly into the software from that program. There's global periods, which will allow you to designate a specific procedure code that can't be done in a certain period of time a second time. For example, if a code can only be billed to an insurance once every 30 days, 60 days, a year, whatever, you can set that up. And inside the ledger and scheduler, it will warn you about that. There's also a messaging program that will allow you to send inter-office messages between users inside the software. There's also UBO4 or institutional billing available in the software.